Women in Butte County are dying of cervical cancer at one of the highest rates in California.
Action News Now anchor Linda Watkins-Bennett joins us now for this week's edition of Wellness Wednesday. So, Linda, isn't this disease preventable?
It is, Haley, through vaccination. And to find out if you have it, it's simply a matter of getting a Pap screening. Now, if caught early, the 5-year survival rate for cervical cancer is 91%. But if the diagnosis doesn't come until the advanced stage, that survival rate drops to just 16%.
Amy Lewis owns 6 Degrees Coffee and is president of Seroptimist International Chico. She made it the group's mission this year to increase awareness of the deadly disease. Lewis lost a dear friend to cervical cancer. Mandy Johnson Pearson died in 2015.
My general manager of my company died of cervical cancer at 34. And I did it to honor her, but also to get the word out so that nobody else has to go through what she went through and her family went through. And I just don't think we talk enough about cervical cancer. I think that young women need to hear about it and take charge of their own body.
Cervical cancer is primarily caused by an infection with the human papillomavirus, or HPV.
High-risk HPV causes 6 different types of cancer, including cervical and throat, and then the low-risk HPV causes genital warts. And it's important to note that HPV vaccine protects against all of these infections.
Alma Gare says one contributor to Butte County's cervical cancer mortality rate is a lack of access to health care. Also, lower vaccination and screening rates. The vaccine is recommended for ages 11 to 18 before exposure to the virus, which mainly comes through sexual contact.
We go to the doctor when we're sick. Our body gives us signs and symptoms that we need to seek health care, but we also need to seek health care to prevent being sick.
Typically, you won't see symptoms from cervical cancer until it's advanced. Screenings are recommended starting at age 21 every 3 years, and from age 30 to 65 every 5 years.
Mammograms are uncomfortable, but you're kind of covered and you walk in and it's over. It's a different experience to get a Pap screening. It's much more personal. But as my mom would say, who was an RN, they've seen it. They don't care.
Now, not having money or insurance is no excuse to not get a Pap screening. There are low-cost and free services available through a state program called Every Woman Counts. It's simply a matter of contacting Ampla Health or your local health department to find out if you qualify.
All right. Thanks, Linda.
Thanks, Linda.
And several cervical cancer screening clinics are planned at Ampla Health on Cohasset Road in Chico, Saturday, March 2nd and April 6th, and Tuesday, March 5th and April 9th. We have a link where you can learn more. Just go to our website, actionnewsnow.com, click on News, and then News Links.